Ever feel guilty about forgetting something or not following through, and then you start wondering, am I just making excuses? If you're a woman with ADHD, chances are that voice is on repeat. But here's the truth. ADHD is real. Your challenges are valid, and accountability doesn't have to come with shame. Today, we're talking about ADHD and accountability. I'll unpack why some women with ADHD struggle with guilt around accountability and how to flip the script. This is ADHD where we talk about everyday life and ADHD. I'm your host, Dr. J. I'm a licensed psychologist who works with those with ADHD. Let's be real. Accountability can feel like a four-letter word when you're living with ADHD. Add in late diagnoses, years of masking, hormonal roller coasters, and the constant fear of being too much or not enough. And suddenly being asked to just be accountable feels like someone casually asking you to lift a car. But here's the good news. Accountability doesn't have to be wrapped in guilt, shame, or exhaustion. When we understand why it hits so hard and how to redefine accountability, we can move towards having more compassion and less beating ourselves up. So let's talk about why accountability hits women with ADHD so hard. The first thing I want to mention is late diagnoses and years of masking. Many women don't get diagnosed with ADHD until adulthood. Instead, they've spent years performing normal, overcompensating, and internalizing failure. By the time that diagnosis finally arrives, accountability feels like a spotlight on every shortcoming that they've been hiding. Research shows that women with ADHD often struggle with masking behaviors that lead to increased stress, anxiety, and even depression. Number 2 is hormones. Estrogen and progesterone fluctuations can significantly impact dopamine and norepinephrine, the very neurotransmitters that ADHD meds target. That means ADHD symptoms can flare during PMS, postpartum, and perimenopause. That can look like 1 week you're thriving with color-coded planners, and the next you're crying because somebody put the spoons in the wrong drawer. Accountability during hormonal shifts requires grace, not punishment. Number 3 is excuses versus explanations. Here's where it gets tricky. Society often labels explanations as excuses. So, I missed the deadline because I lost track of time gets dismissed as irresponsibility, when in reality, time perception issues are a core ADHD symptom. Understanding the difference helps. Excuses dodge responsibility. Explanations provide context. It's not about getting a free pass. It's about telling the truth without drowning in shame. So now that we know what's going on, how do we move forward without beating ourselves up? The first thing we want to do is bust the myth. I want to remind you, accountability does not equate to shame. Too many women confuse accountability with being scolded, but accountability is not about punishment. It's about creating clarity and structure. Shame paralyzes, accountability empowers. Research shows that self-compassion rather than self-criticism is linked to greater motivation and resilience. Number 2, let's talk about what accountability can look like for those with ADHD. Accountability thrives when paired with external support. This might mean body doubling, visual reminders, or check-ins with safe people. Research on executive function interventions shows that externalizing reminders and breaking tasks into steps can significantly improve follow-through. Number 3 is a compassionate structure. Accountability should feel like scaffolding, not shackles. Think of it as bumpers in the bowling alley. It keeps you from getting gutterballed, but you still get to roll your own way. Structure is not about limiting freedom. It's about making sure that you have the right supports to thrive. And number 4 is holding others accountable without guilt. Let's talk about relationships. Many women with ADHD struggle with saying, that didn't work for me, because guilt and people-pleasing kicks in. But accountability in relationships is a two-way street. Healthy accountability means stating your needs clearly, following up when boundaries are crossed, and also recognizing that holding others accountable doesn't make you mean, it makes you a human being. Research on boundary setting shows that people with ADHD often fear rejection more intensely, which makes it harder for them to advocate for themselves. But the truth is, when you avoid holding others accountable, you carry resentment, and that's heavier than an awkward conversation. One of the hardest parts about living with ADHD as a woman is that anytime you try to explain what's going on, people are quick to assume that you're just making excuses. And listen, sometimes we even start to believe that ourselves. The difference between an excuse and an explanation really comes down to whether you stop at the problem or whether you take ownership and have a plan. For example, saying, "I just can't focus, so I didn't do it," might sound like an excuse because it leaves the listener thinking, okay, so now what? But if you say, "I had trouble focusing yesterday, so I didn't get it done. I'm setting a timer system today to keep myself on track," suddenly you've shifted into accountability. You're acknowledging the challenge and showing what you're doing about it. The same goes for lateness. If you say, "I'm always late, that's just who I am," people hear resignation. But if you say, "I struggle with time management, so I'm setting 2 alarms and planning to leave earlier next time," you've moved the conversation into accountability territory. You're still being honest about the ADHD struggles, but you're pairing it with action. Even with something as small as forgetting a task, the difference is in the framing. So for example, if you say something like, "I forgot, my brain doesn't work like that," it might come across as brushing it off. But if you forgot to send the report and you go, "I forgot to send that report, so I added a calendar reminder to make sure that it doesn't happen again," that communicates that you're taking it seriously and setting up a system to support yourself. Here's the bottom line. Excuses stop the conversation at the problem, while accountability acknowledges the difficulty and highlights the solution. Accountability doesn't mean pretending that you don't have ADHD. It means saying, "Yeah, this is real, and here's how I'm working on it." That shift in language builds trust with others, but maybe more importantly, it starts to build trust with yourself. Furthermore, your support system needs to know that if they give you grace and they try to meet you halfway, that you're going to hold up your end. Support is not one-sided. You're a part of their system too. We often talk on this show about the harmful messaging that we can get as a person who struggles with ADHD, or anything really. And that's absolutely true. And on the other side of the coin are people who have their intention of doing their best, who sometimes slip, who are truly only meaning to say, "Help me help you." You struggle with lateness? Okay, yeah, that's stressful sometimes. I might have a moment where I have a reaction. Please give me compassion as well and keep working on expanding your capacity. This is the reciprocal nature of having a healthy relationship. There is give and take on all sides, and we all are trying our best to show up and provide equity for all. So let's talk about a few things that you can do to hold yourself accountable. Number 1 is to externalize. Time perception is a major issue for those with ADHD, which can make it difficult to hold plans and working memory. One of the best ways to build accountability is to stop relying solely on your brain as a filing cabinet. Tools that you can use here are things like wall calendars, shared digital planners, sticky notes, alarms, or productivity apps. So, for example, instead of saying, "I'll remember that appointment," send a phone reminder that screams at you 15 minutes beforehand. And think of your phone as your very patient, non-judgy assistant. Number 2 is body doubling. Working alongside another person, whether it be virtual or in person, boosts focus and task completion for people with ADHD. For example, this could be logging into Zoom with a friend to do parallel work sessions. You could clean your inbox while they fold laundry. Everyone wins, and you don't have to feel like you're in chore purgatory alone. Number 3 is to set micro goals with rewards. For example, instead of saying to yourself, "I need to clean the whole kitchen," reframe it as "unload the dishwasher," then celebrate with a small reward, and then move on to the next task within the kitchen. Large abstract tasks can feel overwhelming. What you want to do is break them into small, doable steps to help reduce avoidance and build confidence. Number 4 is compassionate accountability partners. Find someone who can hold hold you accountable without slipping into judgment. This could be a therapist, ADHD coach, or a supportive friend. Research shows that collaborative accountability systems, not punitive ones, improve follow-through. Here's a little Dr. J tip. Agree on check-ins that feel collaborative. So for example, can I text you when I'm finished drafting this email? Is less intimidating than, will you yell at me if I don't finish my email? Number 5 is to harness hormonal awareness. Tracking cycles can help women anticipate when ADHD symptoms might flare. Another tip here, if you know that you're in a low focus window, plan accountability differently. Schedule easier tasks, use more reminders, or ask for extra support. Number 6 is to ritualize reflection instead of shame. Accountability doesn't mean beating yourself up. It means reviewing what's worked, what didn't, and adjusting. For example, you can have a weekly check-in with yourself and ask yourself a series of questions. What did I get done? What systems helped? Where did I get stuck? This reframes accountability as problem solving, not self-punishment. Being accountable is hard. All of us have moments where we want to throw our hands in the air and do a Benjamin Button. It's not just you, and it's not just women with ADHD. However, if we keep investing in our systems, communicate, and locate the people necessary for our support network, it all becomes a lot easier to do. So I'm wishing you luck on this whole adulting thing. That's it for this episode of ADHD And. Thank you so much for joining me. What is one way that you've worked on accountability? Let me know in the comments. If you enjoyed today's episode, be sure to check out our episodes on ADHD and setting boundaries, where I explain how ADHD makes setting boundaries difficult and give simple strategies that'll help you protect your peace and improve your mental health.